Picture, if you will, the pure, raw prairie. No wires, no fences, no roads, not even a farmhouse. No sign of civilization. This is what a person saw that was crossing the prairie in a wagon more than 170 years ago. They jumped off the wagon, looked around, and declared, "This is where I want to settle and build a town. A great place to live and a great place to raise my family." So they took a risk. They built a house made out of the land, planted food to eat, and cared for the land. Then they wrote back to their friends where they came from and described the great opportunity and promise that they have found. They invited who they knew to join them in their discovery, people they had a relationship with, and so they came, family by family, and those families invited others they knew who they wanted to live with within that community. The communities grew because the needs of the families grew, so entrepreneurs started businesses to meet those community needs. Ice houses, broom factories, general stores, and many other types of sole proprietor entrepreneurial businesses started up within the community. All of our communities across this country, all around the world, were started in this way, with a vision of the future and a plan to grow with people. here. So we are going to try something a little bit different here and see if this will work. Let's see. Okay, does this work? Let me see. Does my audio work now? There we go. All right. I think I just started the show and have about 5 minutes of I hope you can lip read on there. So we're talking about stress today on Rural Community Solutions TV live stream. And Rural Community Solutions is we help communities. We help communities design family-friendly use cases. And then that attracts people. Now, what I was talking about here is people are looking for a community to move. They're not looking for their job and then moving to a community. They are choosing where they want to live, right? And when they choose where they want to live, they're also looking at a housing price. And so I was comparing housing costs, median housing costs. And this is research done by Don Mackey, who is from Entrepreneurial Ecosystems. He's a partner of ours. We work real close with Entrepreneurial Ecosystems, that is a division of Network Kansas. But Don is sitting and does the studies out of there. That okay, let's see. Give me a heads up. All right, thanks. Thank you. I think I have a heads up on that of where we can that the volume and the microphone wasn't quite working. I'm not quite sure what happened there, but I think we've got that fixed. But Don has done some mega trend studies with housing costs, and one of the mega trends that he sees is that people are moving out of the urban areas into rural areas, and one of the factors of that is housing costs. So he was comparing housing costs around an area in Oregon that he is working with and areas in San Francisco. Now, the median cost of a house, the median cost, what is the median? Median is you have as many prices above as you have below. So the median is the exact center price, not the average, but the exact center price of a house. And he was comparing the areas around Portland and some of those areas, the higher cost of areas, and those houses, the median costs were upward of $500,000. Around San Francisco, he said the median costs of those houses were about $1.4 million. And so as you compare those prices of houses, he then said, okay, the next jump of the community he was working with in Oregon, the next jump from that of where commuting distance, kind of like where I live right now, where we live right now is Atlantic, Iowa, which is 50 miles from Omaha. So we are commuting distance into Omaha. But we are outside of the Omaha area to where our housing costs are way low. Now, out in Oregon, where he was comparing that, he was comparing upward of $500,000 home to a community that he was working with right around $150,000 to $175,000 home. Now, that's a difference of right around $400,000. What could you do with that difference? And invest that difference from your housing costs into where you want to go. So that's where people are choosing to live. Now, over this last year, what we have been looking at is, of course, what's on everybody's mind is COVID, right? And that's COVID. So what we are talking about for the rest of this month is healthy people make healthy communities. Now, housing costs are one of the health factors that you can have, because if you have a high housing costs and you lose your job, what are you going to be doing about your house? Right? So if you have high costs of living and you lose your job because of COVID, what are you going to be doing about your costs? Now, we have some statistics and we help communities, we help organizations with how do you handle that stress level? Because we believe that the environment is more important than heredity. Your environment, the environment that you create, is more important than heredity. In other words, that environment that people are living in, your community environment, your business environment, your early care and education facility environment. That's why that's important, is because that's the environment where kids grow up. Now, I read yesterday that babies are studying to become people between the ages of 0 and 6. They are studying you to become people. Babies are training to be people. When you understand that environment that a child grows up in becomes extremely important, because they are training in that environment to become the people in the next generation. And that's why we look at communities. What's going to be happening in 25 years? Why is the decision you are making? How is that decision you are making right now? How is that going to affect kids? And what is going to be happening in that environment when you affect kids? Now, we also showed you yesterday a slide that is this. It's that here's the stress by the numbers. Now, this is general stress, okay? And it's probably higher. And I'm going to show you that statistic that it is higher here. This is what's happening within your community. And this is why it's important for you to pay attention. This is what is happening in your community. 40% of your community members, Americans, are saying they lie awake at night because of stress. Okay, and that's probably higher, and it is higher, and I'm going to show you. 70% are stressed out about work. $300 billion is the cost to American businesses because of employee stress. Now, that cost is because of loss of time, not productive. They might be having difficulty with family members. They might be having difficulty with some relationships, but it's that stress around work that they're losing productivity. They're calling in sick. They need that, what they call that mental health day. They just have to take the day off and de-stress. They avoid coming into work on Monday, and they make themselves sick because of that. And it's a cost to employers. It's in cost to your employers. 76% of all the boomers are worried about their money. Now, we are in that generation of the boomers, and there are thousands of boomers every day that are retiring. And 76% of those boomers are worried about their money. 52% of all Americans are worried about their health. That is higher. Let me show you what this means. Here is updated data. This is from the American Psychological Association. Okay, updated data about COVID. All right, parental sources of stress as a result of the pandemic. 74% of those surveyed here, 74% of these sources, they were worried about a family member getting coronavirus. 74% were worried about the government's response to the virus. 74% were worried about the disruptive routine and adjusting to new routines. 73% were worried about getting the virus. 71% were worried about managing distance learning, online learning for their children. 70% were worried about obtaining and having their basic needs. In other words, their food, housing. Are they going to be hanging on to that? 67% were worried because of self-isolation. They're not getting out enough. They're social animals, and they're not getting out and networking out of the house. 66% are worried about their access to health care. This doesn't break it down into urban versus rural, but I would bet that the rural statistic is higher than that because of access to rural health care. 63% are worried about missing out on major milestones. They are missing grandchildren's birthdays. They are missing grandchildren's Christmas. They are missing New Year's. They are missing those celebrations of getting with family that they would normally be attending. Okay. So that is stress by the numbers. What happens with stress? Where does it go? What causes stress in a person? All right. And so we look at this diagram of the brain. And I want you to pay particular attention to the amygdala. The amygdala is right here. Follow, if you can see my cursor, or my arrow of my mouse right here. The amygdala right here, and you follow that line, and it is right above the hippocampus in your brain. Why is the amygdala so important? Well, the amygdala in your brain handles your fight or your flight syndrome. In other words, when you have something that you're facing, right? When you have the event that you are facing, your natural response, because of this is our animalistic response, is either to flee and run from it, as if a lion or a tiger, the saber-toothed tiger, is chasing you. You want to run from it, or you turn and fight it. You take your club and you start swinging at it and you fight it. So that is your fight or your flight. It's been with us ever since we were created as man and as a human being, as man, woman, as a human being. This is part of our physical makeup. This is how we have been created. We all have a fight or flight. So when we are faced with a situation, we have a reaction to that situation. And that reaction causes stress. That reaction causes a result in our body. We can either worry about it and run from it. We can forget about it, but we're still going to worry about it. And if we hang on to it, hang on to the emotion, then that causes stress. That causes our body to react to that stress. Now, over time, that stress then creates sickness in our body. And this is from the Chopra Institute, but this is from doctors that are looking at that, of what causes stress within our body. What happens when that amygdala hangs on and our memory hangs on to that, and over time, we hang on to that fight or that flight response. This is the impact of being stuck in fight or flight. All right, your physical reaction when you hang on to it is your blood pressure rises. So your long-term impact of that is heart disease. All right, or you could have digestive system slows. So you have, in the long term, gastrointestinal problems. Now, I'm not a doctor, and this is not me dispensing medical advice. This is research that has been done. This is what they have found, and this is what happens to your body when you hang on to the tension and the stress over time. Right? When your immune system weakens, right, you get infections and you get cancer. Now, over this last year, we have been hanging on to what has been happening in the COVID world and worried about what is happening within our families about COVID. We've been worried about family members getting COVID. We've been worried about how are we going to educate our kids. We've been worried about, is my family safe? We've been worried about, I can't be with my family. We've been worried about our basic needs. Am I going to be hanging on to my house? How am I going to feed my family? I have lost my job. My business is not bringing in any income. What happens over the long term and what we do with that stress is going to affect our communities in the long term. So you as communities really need to pay attention to what is going to be happening in your community, specifically in your medical community, on what's going to be happening with heart disease, what's going to be happening with anxiety, insomnia, addiction problems, all right, weight gain, obesity, aging, infections, cancer rate, heart attacks. Those types of situations within your community could be on the rise. And it's the long-term effects, what's going to be happening. So how your community addresses the stress of your individuals is a health concern. Healthy communities and healthy people make healthy communities. What are you doing to reduce the stress in your communities? Now, there's some steps you can take, and there's just steps that you can help with them. You can create meditation classes. You can create meditation Zoom programs. You can create functional medicine type of situations. I'm not a doctor, but we do use some of these techniques in our business to help early care and education providers reduce stress within their business. And it helps with kids. There is research out there, and we can share some of this, but there's research out there where the stress level in children in classrooms has reduced because of processes they have put in place of emotional freedom technique and also meditation techniques of kids just taking time and focusing on their breathing. Reducing stress helps individuals heal. It helps individuals face what they're trying to face, and it helps individuals create a new type of situation. Stress is caused by our response to an event. The event doesn't cause stress. It's our response to that. So I want you to look at this gap. And I've talked about this gap before. You have an event and you have your response to it. When this event happens, the further away your response is from that event, in other words, putting that gap in between the event and your response, that's called mindfulness. Mindfulness of how are you going to respond to the event, right? And so that will help you reduce your stress. Training people how to do that is an event that your community can take on. How do you reduce that stress, right? The event, your response to it. It's not the event that causes the stress, it's your response to that. When you increase that gap and pay attention to that gap of how you are going to respond, you actually take back control of yourself to respond to that event. That will reduce your stress. That will reduce health emergencies. That can help you reduce the potential of health consequences from that stress. If you want to know more, contact us at Rural Community Solutions and at frank@ghorizons.com or kim@ghorizons.com. We'd be glad to talk to you about how do you reduce individual stress? How do you increase your nutrition? How do you connect a mind and body between nutrition for your gut and thoughts for your mind, which is both food for your mind and your body? And how do you respond differently to the events that are going on in your life? When you reduce that, you actually become healthier. We're here to help communities have healthy people. They make healthy communities, and the individuals are happier, the individuals are more prosperous, and the individuals have a better outlook upon life. So I'm Frank Spillers, and this has been Rural Community Solutions TV live stream. We're here every day, Monday through Friday, 11:30 a.m. Central Time. sometimes with technical difficulties as we started out with, but most of the time we just have a great conversation. So get a hold of us. Let us know what you think. Leave a comment down below in YouTube or on our Facebook page. We're anxious to talk to you, but more than that, we're just anxious to create that relationship with you. So come on back tomorrow. We'll be wrapping up our first week of healthy communities and of healthy people make healthy communities. See, that's that live thing in there. Healthy communities make healthy. You know what I'm trying to say. Healthy people make healthy communities. As we talk about that, we're going to start connecting the mind and the gut. How you eat affects how you think, and how you think affects how your body responds to with the stress, and your body responds to down to the cellular level. We're going to be continuing that conversation, but remember, we're not doctors. This is just what we teach. All right. Contact your doctor, consult your doctor before you try anything, just to make sure that you are healthy enough to address this. But take care of yourself. I'm Frank Spillers, and on behalf of Kim and on behalf of Kim and myself, we hope you have a very, very good day, a safe day, and just stay positive out there. We'll see you tomorrow. Have a nice day. Bye-bye.